Today I'm going to talk about refeeding syndrome. Now I know that I've made a video about this before and I've been banging on about this on my blog and my website, but it's really important that everybody is aware about refeeding syndrome before they start increasing their calories in recovery. So I wanted to cover it again and add some more information. Now I've been looking at Marzipan, which is the management of really sick patients with anorexia nervosa, and I've been looking at their guidelines which cover a lot about refeeding syndrome. Now refeeding syndrome is really rare, and it's very rare even with people with anorexia and even rarer in those with other eating disorders, but you might still be at risk with any eating disorder that you have. So everybody still needs to be very aware of this. So I have made a post about it, so I will be reading from this post. Sorry if I'm not so interactive with looking at the camera and everything. So refeeding syndrome is a potentially fatal condition that occurs when patients who have had their food severely restricted are given large amounts of food via oral or nasogastric refeeding as well as during TPN. It has been noted in outpatients with anorexia nervosa who have suddenly increased their food intake after several weeks of starvation. For example, someone who's been eating almost nothing for a week or so could decide to recover and start eating a regular amount of food straight away. Now, going from pretty much nothing to a regular amount of food means that their serum phosphate level could then fall dangerously and require oral phosphate supplements to correct this abnormality. Refeeding syndrome is characterised by rapid reductions in certain electrolytes such as phosphate and potassium caused by rapid transport into cells, and the resulting cardiac effects can be fatal. Avoidance of refeeding syndrome can be achieved by gradually increasing nutritional intake. There is a substantial variation in opinion about the level at which to start refeeding a patient with anorexia. Some units follow NICE guidelines for adult nutrition support, which recommend starting at 5 calories a day for a patient weighing 32 kilograms. Although the guidance excludes eating disorders, it is considered by some to be relevant to patients with severe anorexia nervosa. However, there is a wide variation in its application, some physicians and dietitians applying it strictly and others regarding it as not applicable to this patient group. One of the very few published guidelines in this area from the USA, referring to the treatment of children with anorexia nervosa, advises patients start on 1,250 to 1,750 calories, depending on the patient's intake prior to hospitalization and severity of malnutrition, and advance by 250 calories daily. For patients with very low weight, below 70% of average body weight, the protocol is altered and calorific intake requirements may be decreased to avoid refeeding syndrome, and advancement takes place over a longer period. So you can see that the guidelines kind of vary. It's not a strict thing, and it does depend on who's treating you as to what they might decide that they want to start you off at if you are being hospitalized. Now, again, this is all in a hospital setting, so it's a bit different to recovery by yourself away from a hospital. Some physicians are torn between the risk of refeeding syndrome and the risk of further weight loss due to not eating enough, which could then obviously mean death. In addition, one physician in the group suggested that it was perhaps less harmful to risk refeeding syndrome, which can be monitored and corrected, than brain damage and death caused by low glucose in a patient with hypoglycemia. It is also commented that if higher calorie levels were thought to be essential, e.g. to correct low glucose, a critical care approach with constant monitoring and correction of abnormalities should be considered. So with refeeding syndrome, it is dangerous if not treated, but in a hospital setting these things can be corrected, especially if they're weighing up against another risk which could end up in death. So it's kind of about weighing up the risks of what is more likely to happen and what is more damaging to the patient. When it comes to dangerously sick patients with anorexia nervosa, the risks have to be weighed up and a decision reached as to what is more dangerous for the patient who is in a life-threatening condition. So on the subject of avoidance of refeeding syndrome, avoidance of refeeding syndrome can also be encouraged by restricting carbohydrate calories and increasing dietary phosphate. When patients are prescribed oral or enteral nutritional supplements, consideration should be given to the use of high-calorie supplements, as they have lower levels of carbohydrate and may therefore be less likely to produce refeeding syndrome. Moreover, the diet should be rich in phosphate, e.g. milk, to help avoid the syndrome. So again, remember that the marzipan guidelines described are based in a hospital setting. So I also found on another website, refeeding syndrome is extremely rare, but is more likely to occur in a young person with rapid weight loss and a BMI that is below 0.4th centile, who has eaten little or nothing in the past week, who has abnormal biochemical parameters. So as I said, refeeding syndrome is rare. People at risk are generally very underweight and have severely restricted for a week or more. However, if you have been eating less than 1,000 calories for a week or more, you are excessively exercising or you have been purging frequently, you may be at risk of refeeding syndrome, regardless of your BMI. If this is the case, please see a doctor to determine the risk of refeeding syndrome. Depending on your risk, you may be hospitalised to be monitored there, you may be monitored by your doctor, or you may be okay to go home and just get your parents or flatmates to keep an eye on you. You are most at risk in the first 24 to 72 hours. So if you have upped your intake quickly and you've been eating an adequate amount for a few weeks, don't worry about it. You will be out of the danger zone by now. Milky products are also really good for those lowered phosphate levels and are easier for the body to absorb. So that's quite good for the beginning of the recovery when you are upping your calories. There's also a problem with people being overcautious and not increasing by enough or fast enough. If you are being monitored in a hospital setting, the staff there will decide what your calorie increase rate is. If you are home and have been deemed to be at very low risk, I advise increasing your calories by 250 calories every 2 to 3 days until you reach 2,000 calories. From there, it is safe to jump to your 2,500 to 3,000 plus calories. So this is really important because it is a potentially life-threatening condition. So if you do think that you may be experiencing it, do call 911 or 999 immediately. Now, I have looked on various sites for the signs and symptoms of refeeding syndrome, and they all seem to be different in different places. It's very difficult to get information online about refeeding syndrome actually, and the marzipan guidelines have been the most informative for me, but they don't actually talk about the signs. I will have a look further for the signs and symptoms of refeeding syndrome, and I will post them in the box below, the description box for this video. So do remember to read the description box as well, because when I upload the video I will put the signs and symptoms in there as well, as many as I can find. But apparently refeeding syndrome is very hard to miss. You will be feeling absolutely terrible and you will want to call the emergency services straight away. But yeah, remember, it's very, very, very rare, but obviously to avoid any risk, if you are coming from a low amount, as I said, or purging very frequently or very excessively exercising, then upping your intake slowly is a good way to go about it, just to make sure that you're going to be okay. And obviously as you increase, do have someone to monitor you if you can. It's best to have that. What happens in a hospital setting would be someone would take blood tests like every time an increase is made to check everything is okay so that they can further increase again. But do remember that those kind of drastic measures are in a hospital setting and for very, very, very sick people, physically sick people. So yes, basically do be really careful when it comes to this topic. If you may be at risk, increase slowly. Don't go straight from almost nothing to an adequate amount, because it affects the body in quite a significant way and it might be too much for your body to handle. Obviously don't freak out too much about this. I'm going to say it again, and I know I've said it again and again in this video, but it's very, very rare. It's not something to freak out about, but it's definitely something to be aware of so that you can be safe and keep your body safe. So yeah, that is all for today. I hope that this does make everybody aware and think about their recovery process before increasing those calories. I hope everyone's well and that everyone is fighting hard towards recovery. I will speak to you in 2 weeks.